Hi everyone, and welcome to this episode of On My Mind. Today I'm joined by Dr Craig Joyce, who is a professional working with children who have experienced adverse childhood experiences. We're going to be talking about what is an adverse childhood experience and how that will impact us as we move into adulthood. So you can expect to hear all sorts of different things. We meander through different topics around relationships, around schooling, parenting, all that kind of stuff. I would encourage you to really listen to this one because there are some really powerful insights in there that I think are useful for everyone, and not least highlighting that we all have a role to play in making children safe in the world. The bit that stood out for me was a bit towards the end where we talk about how the impact of our childhood can affect our relationships going forwards in our lives. So I definitely encourage you to listen to that. Craig's a great guy. We have a really nice conversation. He's also got a top accent as well. So tune in, enjoy, and let me know what you think.
The only thing I could liken it to is like being hit by a truck. It's like a moment in my mind that's been erased now because it was quite a traumatic experience.
One human is amazingly complex. You add a second human and try to have a relationship, and how complicated things get.
Suddenly, I feel like all of my history was a lie.
There's nothing wrong with you, right? You're not bad or wrong or broken or, stuck, and it's all healable.
People's stories have the power to transform the way we see the world and the way we experience our lives. I'm your host, Adam, and I'll be guiding you on this journey. So sit back, relax, and find out this week what is on my mind. Just before we begin, it's worth noting that this episode includes themes around child abuse, domestic violence, and post-traumatic stress disorder. So as always, take care of yourselves when listening.
I read a book years ago. I think it was called Finding Your Own North Star. And she talks about your social self and your essential self. And your essential self is the stuff that you think you really should be doing that kind of feeds your soul. And your social self is the thing that says, I should probably, I would like to do that, but I can't because actually I want to have a career and money is important to me and success and reputation and what people think of me. But sometimes I think you need, I'm sure you posted something maybe about a couple of years ago. I remember it was about, you posted a tarot card. You picked the lightning struck tower. And it was, and what I thought was interesting about that is actually sometimes I think you have to have a complete sort of unraveling where your familiar structures are just totally blown apart for you to then regrow or have some kind of rebirth, I suppose. But I was thinking about, why I decided to be an educational psychologist, and it was because my mum died. And I remember Dad had said to me, I kind of want you to do something that you really want to do, that she'd want you to do. What would that be? And I said, I want to go back and I want to do more training. I want to be a psychologist. That's what I wanted to do. But I always had this thing of putting it off, thinking that wasn't possible. And it took like a really big event for me to think, right, I'm going to seize that and use that as a change process. It's strange, isn't it?
It sort of almost gives permission, I think, to reassess and to realign. And sometimes it does, like you say, have to shake you to your foundations, especially when it's things like loss, bereavement.
It's painful as well, isn't it?
Yeah, pain, I think, can give birth to fresh growth. I don't think there's any such thing as...
And it seems like a cliche, that, doesn't it?
Yeah, it does.
You have to be through pain to regrow and be stronger. But actually, there is kind of something in that is not ridiculous. It actually is true.
Yeah, all the cliches come in, I think, when you've been on a bit of a journey, and even saying when you've been on a journey sounds a bit cliche in itself.
But I don't think it means that I don't think it's because you've had a journey means that you're done with it, though. I always think it's going to be a work in progress, because when you look at your foundations of what you believe to be true and knowledge and relativism and realism and all that kind of stuff, you do get to the point a lot of time where you think, oh God, I really believed that because of social constructs or doctrine or whatever, and I still find it uncomfortable. I don't think I'm ever going to be at peace with that. I can't imagine it at the moment anyway. It's uncomfortable.
Generally, I think you're right. I think getting into psychology or any sort of occupation that's to do with the mind, it's like going down the rabbit hole. And I'm just trying to get comfortable with being uncomfortable.
That's a work in progress.
I think it'd be life's work.
People love, medicalized definitions of things. They've got ADHD, they've got autism, they've got Tourette's, they've got, trauma, they've got an attachment disorder. They love, the labels make people feel really comfortable, don't they? Because it's like, I know what it is. And it's like, well, but do you really know what that is? Or the term autism is just a collective noun for lots of different things that people have gotten together and say, let's call it autism, It's, I think people love that sense of knowing, I can see why people enjoy doing maths or physics or something like that, because they get a right or a wrong answer, and that's comfortable. Psychology is not like that at all.
I think to go into this field, if you're going to be a psychologist or a psychotherapist, you're going to be interested in root cause, aren't you? You're going to be interested in the unraveling and the digging and the analysis and unpicking. So let's get into this then, shall we? We're going to be talking about adverse childhood experiences because, just to set the scene, one of the reasons why I was so passionate about when we sort of started talking and you said that you'd be happy to come on and do a podcast, the whole idea is about helping people understand what hurt in the first place. It's about, we are where we are, we've got the behaviours that we've got, but I think, certainly speaking for myself, I had a sense of empowerment when I understood that, that's why I'm like this, that's why I behave in that way. That doesn't necessarily mean that it solves it. It doesn't necessarily mean that in and of itself changes the behaviour, but understanding where those behaviours came from in the first place, I think, can be really empowering for somebody to realise that. I read a quote the other day, and it said we need to stop asking people what's wrong with them and start asking them what happened to them. And that's where this piece of kind of adverse childhood experience research comes in, and I think can answer a lot of questions about people's behaviours. So why don't you start by giving us an introduction to yourself and tell us who you are, what you do.
Okay, so I am Dr. Craig Joyce. I'm an educational and child psychologist. I was originally an English teacher. I trained as a teacher about 11 years ago, and had always had an interest in the behaviours, I suppose, of the young people that I was seeing in the classes that I taught in. I think a lot of the time the school system we're obsessed with behaviour, controlling behaviour. What is behaviour? Why does it happen? And teachers become obsessed with this kind of notion of, having to control behaviour. And I always found that as a teacher, you're never given enough time to be able to sort of unpick some of what is going on for some of the young people, huge swathe of young people that you come into contact with. So I decided to train as a psychologist. I went back and did my master's degree at the University of Manchester. That was followed by a PhD in the psychology of education. So I was interested in looking at preventative programs, which are designed to bolster the mental health and well-being, I suppose, of children and young people, and help teachers and parents to feel more sort of empowered to help work with mental health difficulties. But found that the original reasoning for me going into psychology was I wanted to be a practitioner. So I was kind of drawn off a little bit for a good 3 years or so into doing research, and still had that hankering to want to be a practitioner. So I added on, I suppose, to my PhD and did a doctorate in educational and child psychology. So it's a bit of a joke, isn't it? Doctor. I feel like So I ended up doing a double doctorate, which was 6 brutal years of thesis and research. But I think I would say having been a practitioner and researcher combined has probably made me better at what I'm doing now. But so my interest, I suppose, as a practitioner psychologist is in the seeking to understand the why and how children are in the place that they're in. So where teachers are always looking to try and control behaviour, my sort of interest is why has that occurred in the first place? But like the iceberg, you're seeing that little bit that pops at the top, but there's this huge underpinning that all all behaviour is communication, and it's telling us something about how that young person is feeling, and we really need to seek to understand how young people are feeling as opposed to understanding. I think if we understand their feelings first, then we can start to kind of work on the behaviours. But I suppose over the last couple of years, I've always been quite drawn to developmental and relational trauma. I think you'd be very surprised, I suppose, of how many young people have experienced developmental trauma. It's, Public Health England and Wales, I think they roughly say about half the UK population have probably experienced something called an ACE or an ACE, an adverse childhood experience at some point in their life. 1 in 10 children have experienced 4 or more. And what we know is, when you look into research like developmental cascades or cumulative risk, is that the more risk factors that we have in our lives, generally the worse our mental health outcomes are as we get older. So it's really, really important. I suppose I feel quite hopeful working with young people that this is the kind of a good playing field to be able to sort of help children at this early stage, where their early experiences are so formative into the people that they become when they're older.
So you've used a couple of a bit of lingo there in terms of developmental trauma.
Yeah.
To just give a definition of maybe what is developmental trauma, and maybe a few examples, just so people can understand what that's about.
So developmental trauma would be a term which is separate from what we tend to understand as post-traumatic stress. So post-traumatic stress happens when we have a incident which causes us to go into a really dysregulated state. So when we say when we're dysregulated, it means that we might lose control of our bodies, we might dissociate, where we feel kind of shut off from our kind of conscious experience. They used to say, the term kind of came around originally from, it was first noticed around soldiers in the war. They came back from war and they were called shell shocked. And over time, we developed this understanding of post-traumatic stress and how victims, I suppose, of that would continue to suffer or have flashbacks or hypnagogic regressions, if you want to use that term, for years, sometimes afterwards. So they don't heal in a conventional way. It's a cycle that repeats itself. But what we now know over the last couple of decades of research in children and young people is that we call something called developmental trauma when young people experience trauma consistently as they grow up through the lifespan. So that might look like, a young person who has been subjected over a number of years to witnessing or experiencing domestic violence, or living in an environment where they've been emotionally abused or they've been made to feel worthless. Physical neglect, where their basic or their essential needs are not being met. So where they're not being fed properly, they're soiling themselves, and their beds aren't being changed. Things that are just they become very unkept. And what we know is that the more of these experiences that we have tend to be the worse the outcomes are in the long run. So we know that we're drawn, particularly in my field, to look after children. They are they've been taken away from their parents or something has happened to their parents, but they generally have lived experiences that can be very, very difficult. And a lot of that is around these ACEs that they might have experienced.
So, I mean, you mentioned a few there, and I did have a list in front of me, and it's obviously disappeared because that's what happens when you need something. But the adverse childhood experiences, which you're referring to as ACEs, one of them you mentioned was sort of witnessing domestic violence, which is, I suppose, something that as a therapist I come up against quite a lot in my practice. And a lot of people, firstly, don't understand what domestic violence is. But could you explain to us what sort of an impact what impact it has on a child to witness domestic violence? And that could be, from my understanding, just watching parents argue all the time. So hearing shouting behind closed doors, raised voices, that kind of thing. What's the sort of longer term? What's a short term impact, and what might be the longer term impact on a child?
Well, the thing is I suppose that that question kind of links to sort of why there's a wider sort of hypotheses of where you might be coming from, of how that might affect a young person. So in the early sort of 1970s, you'd be looking into what we call attachment, the psychology of attachment. John Bowlby, Mary Ainsworth looked at our attachment patterns with our caregivers, how that shaped our experience of our relationship with adults and partners as we get older. Still think it's very relevant, but a lot of the time children who've experienced attachment difficulties, which is that where you have a synchronous bond, or you should have a synchronous bond with a caregiver. So an example of this would be, if I was to try and describe to people that don't know what attachment is, might be that I was in the car, maybe a couple of months ago, and I was in traffic, and I was at traffic lights, and this mother had a toddler, and the toddler was kind of tottering away in front of her, and looked very kind of confident. And there was a guy came around the corner, and he was walking a dog. And the young person, he turned round, tottered straight back to mum and took her hand. And for me, as a picture, snapshot, that is what we would call a secure attachment relationship is, that young person feels they're safe and secure to go and explore the world, but they know that there's a safe base there for them. What happens when children experience trauma? So, for example, domestic violence or sexual abuse, or anything like that, is that we have things called ruptures. We have ruptures in our attachment relationships, and anybody who's had a parental relationship knows that our experience is often about rupture and repair. So we fall out with our parents. They say, the ideal relationship is that I'm still here, I still love you, I'm still available, everything is okay, let's continue our relationship. But what happens is a lot of the time that when these ruptures occur, young people, their schema, which is how they see the world, Piaget, early developmental psychology said that our young people develop these blueprints for how they communicate with adults and understand society based on our earliest lived experiences, and that is usually through our caregivers or our parents. So if a young person, for example, witnesses domestic violence all the time, they either witness it or they experience it, their logic model, I suppose, is that they love their caregiver, but their caregiver treats them harshly or inconsistently. Therefore, the value that they place on themselves is that I'm unlovable, I'm bad. If I'm being punished by somebody I love, I must be bad. And that they then take that blueprint to other adults. So they think all adults might be inconsistent or mistreating of me or harsh, or believe that I'm unlovable. So that early sort of attachment relationship that can be shaped through trauma creates difficulties with teachers, with partners as we get older. Does that kind of answer that a little bit?
Yeah, and to expand on that, if I'm right, the reason why the child who's mistreated by a parent will internalize that as there being something wrong with them is because in the child's mind, the parents have to be faultless because they are responsible for looking after them.
That's right.
So the child has to see their caregiver as a god, if you like, and so will shoulder any fault in the caregiver will be internalized by the child, and that's why it leads to that low self-worth, because it internalizes as there's something wrong with me, which is why I'm not getting the love and affection off my caregiver.
Exactly. Or I expect my caregiver to be inconsistent, therefore everyone will be inconsistent with me. But you were asking about how developmental trauma occurs. And if you look, for instance, at the work of Dr. Bruce Perry, for example, he talks about the neurosequential model of trauma. And what we know is that traumatic experiences tend to happen on 3 different levels. Or he talks about the fact that relational trauma requires relational repair. So what we know is that our most primitive brain experiences from our brain, so for our reptilian brain, so that's the part at the back of our neck here, and that is part of our autonomic response. So, us talking right now, we're breathing, we're blinking, we're I'm perceiving things all around me all the time that are a potential threat. So I'm even on a subconscious level, I'm clocking my environment around me, but I'm obviously feeling safe, I'm feeling secure, I'm at home, so I'm regulated. So then I sometimes use a hand model for this, but we've got then inside our brains, we've got something called our limbic system. And our limbic system is connected to our emotional experience and our emotional memory. It's on a little gland called the amygdala. It's about the size of a walnut, and that sits right inside our brain. And that is the part where our emotional experience and our emotional memory linked to our hippocampus is created. Now, when babies are born, that emotional response, their limbic systems are fully developed, but this prefrontal cortex, the most developed part of our brain around the front, is the bit that develops last. So the ability to have higher order thinking, to have cognition skills, problem solving, the use of language, all those things come later. We are hardwired from infants to respond to the emotional information that we are given. So that synchronous bond, that attachment relationship where parents are going, oop, 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 they do this motherese, they do this baby kind of talk, there's lots of eye contact. It creates a synchronicity, a synchronous relationship between parents and their care and their infants that help that young person to feel secure. Now, what we know is that when that attachment relationship goes awry, children are constantly in a hyper-stimulated state. So, those brainstem responses and that limbic system are constantly in excitation. So you might find that when you're trying to talk to a young person about something that's upsetting them, they can't focus on what you're saying because they're scanning for threats. They hear a door slam and they feel at risk straight away. So we know in terms of developmental trauma, we have to focus on how to help children feel soothed to begin with, or how to make them feel safe, or how to reduce sensory overload before we start talking to them about what those problems are. So it works kind of in sequence, but it's harder to repair than it is for a young person to experience trauma in the first place. We're hardwired for survival.
So we could say a caregiver's responsibility, first and foremost, is to create a safe environment for the child.
Absolutely.
And to help that child regulate themselves if they feel in any way threatened at any point.
Scared.
So say, for example, scared,
yeah.
to help the child make sense of what's happening to them, but to also sort of settle them down back into a regular state. But if that's absent, or if the opposite exists in the house, so say, for example, there's shouting, there's violence, there's caregivers that are misusing substances, for example, and they're not able to provide that level of safety for that child. What you're saying is the child will grow up to think the world is unsafe, and so therefore I need to be hyper-vigilant and looking out for threat the whole time. But that's not necessarily something that happens consciously. It just happens because they're trying to survive in a chaotic world.
That's it. That's it exactly. It's our survival response is we are primed to you might have heard that phrase before about self-preservation is key. Self-preservation is key, and that is what it comes down to. Is that when the chips are down, every organism on Earth fights for its own survival, and humans are no different from that. We may have well-developed neocortexes that have given us language and higher order thinking skills, and have helped us evolve, but we are still essentially primed to act like an animal in terms of when we feel at risk or we feel unsafe. And that's a funny thing, really, isn't it? Because we're on one level we kind of had these expectations of young people just to be okay, but actually there's a constant push-pull between, well, actually I don't feel safe. So what I'm constantly saying to teachers, for example, or parents, is that there is absolutely no point focusing on literacy or numeracy or whatever you want to get through in the curriculum if that young person is not feeling okay and they don't feel safe or they don't feel loved in that environment, is that they're just not going to be able to focus. And get what you want to get out of them. And I mean, yeah, I don't want to get political, but I think that's part of the problem with our education system at the moment. I think is that we focus so much on the academic side of things that we're forgetting that a lot of children don't feel okay when they come to school. Actually, it's a marvel sometimes that some children get to school at all, with their lived experience.
So I suppose joining up the dots there, if you've got a child that's had this sort of developmental trauma growing up, so they've not understood how to regulate themselves to feel safe, they then come into a classroom environment where there is pressure to perform, which is sort of adding a perceived threat, really. So that what you're saying is the part of the brain that's responsible for rational thinking, problem solving, math, science, that kind of thing, it is sort of offline a lot of the time or significantly reduced in activity, and the amygdala part, which is responsible for the fight-flight responses, is sort of activated. And I suppose that sort of links in with, and you will work with some of these labels like ADHD, and I was reading a book called The Body Keeps the Score the other day, and he's a psychiatrist, the guy that wrote that book, and he's got a bit of beef about those labels, because he's essentially saying to label a child with ADHD without understanding that child's history is a real miss. Do you have an opinion on that? I'm absolutely in line with his thinking. I think it's one of the key tenets, I suppose, of my work, that I'm constantly having to help reframe how people think about children with difficulties, and adults with difficulties, I suppose, to a large degree. But when you're looking at children that, for example, if you're looking at that, we call it that neurosequential model of trauma, you might be looking at a young person in class who can't sit still. So they're constantly, they're moving around, they're hyperstimulated, they need movement breaks, they're getting out their chairs, their postures, they're shifting their posture all the time, they're fiddlers, they're biting the skin around their fingers, all these things which are suggesting to me that young person is not feeling comfortable in that environment. Now, through the gaze or the lens of ADHD, you would be looking at that young person and saying, that young person is hyperstimulated, they're hyperactive, they're impulsive, they've probably got ADHD. And the issue with that is that we often fail to acknowledge I use a term called comorbidities. So that's a term where one presenting set of symptoms is largely crossed over with another. So, for example, attachment, when I was talking about attachment before, some of the difficulties with children that we might regard as being insecurely attached often present in the same way that children with autism do. So there's been a lot of young people over the last decade, and it's been a lot more acknowledged now, which I think is a good thing, is we often have had misdiagnoses of children with autism when actually they have had real relational or traumatic experiences going on at home, and that diagnosis is just not appropriate. So what I am often doing when I'm speaking to my colleagues in clinical psychology or in pediatrics, I'm saying we have to look at what this young person's lived experience is like. If everything else really adds up, and if they are really secure at home and things are really good, and they have there are no obvious presenting reasons to why they might be like that, okay, maybe we'll have a look at that presentation. But I think unless you seek to understand the lived experience of young people that you are coming into contact with, those diagnoses like autism and ADHD are either inappropriate, but they can also be dangerous. You consider that that's the big labels, the strong labels to have, for a lifetime, and they reshape how young people think about themselves and how other people think about them. And I think if we're not aware of ACEs, for example, and some of the things that are going on, parents will often, think it's either themselves and they'll blame themselves for it, or they'll go down the road of thinking, it's ADHD, it's autism, it's Tourette's, it's because there's a comfort, isn't there, in
giving it a name or giving it a label, because it takes away that uncomfortable feeling that we might be responsible for it, or that we have a part to play in that. Labels kind of take that away, don't they?
Yeah, I'm always interested in labels and the reason why people want them, and I think in some ways, yes, it can give people comfort, but talking in this context, I suppose it could actually be dangerous for a child because with ADHD, there's medication out there to medicate symptoms, and actually, if you're not understanding the history of that child, you could be maintaining a dangerous environment for them at home by just medicating a symptom. So I suppose, as you said, mindful not to get sort of too political, but I suppose it's a...
Oh yeah, but you're right. When you're looking at drugs like methamphetamine, which most commonly people would know as being something like Ritalin, all children who would be prescribed methamphetamine would improve their concentration and their focus. All children. So it wouldn't matter. You wouldn't actually know if they were ADHD or not, because the drug that you're giving them would improve your concentration or mine in the same way that it would improve a young person. So that diagnostic, I suppose, procedure of how they go about looking for it, the medication is sometimes, wholly inappropriate, but it would have the same effect on any child. So how would you know?
But this brings us to sort of what we were talking about before we started recording the podcast, about obsession with medicalizing things in the West, and it seems like if it doesn't fit in a neat box that can have a diagnosis and a treatment, if it requires sort of more exploration, i.e. more resource, we seem to sort of want to steer away from that. And I could perhaps get on a bit of a high horse about the reasons behind that. But what I'm sort of hearing and the things that I've read about adverse childhood experiences and these diagnoses is that we're not serving the children, are we? That we're meant to kind of be looking after by missing their history.
No, we're not. And the thing is that we have to be conscious, I suppose, of it's a complex issue. It's a very complex issue. Because we're not just talking about, you might be talking about more than one adverse child experience. You're talking about things that might have happened over a number of years. You also need to take into account what we call protective factors. So things that help us repair, or things that help us, I think of it sometimes a bit like scales. So the more aces, I suppose, you have on one side, the scales will tend to tip. But what we want to do is to try and pile as many protective factors on, I suppose, on this side to help balance that system out. And what we often see is that I think the more aware people are of these things going on, the more empowered that they feel to be able to prevent them, or if not prevent them, help negate them. So helping a young person feel like they've got a secure, trusted adult that they can speak to on a regular basis, for them to feel like they're not hungry all the time, to make parents aware that if shouting is going on in the home all the time, the effect that might be having on children. And I don't think as a society, I don't think that we're that conscious of that all the time. And maybe it's because parents that are having difficult times as well are stuck in their own lived experience, and they're not seeking to understand what effect that is having on their children.
I've got it in front of me now, a source from Public Health England, and it talks about people who a UK study suggested that those who have got 4 or more ACEs, so 4 people that have got had experience of 4 or more adverse childhood experiences, are 2 times more likely to have a poor diet, 3 times more likely to smoke, 5 times more likely to have had sex under the age of 16 years, and 6 times more likely to have been pregnant. So, and I know that there's other statistics around sort of like a significantly increased risk of depression and anxiety,
diabetes and cancer as well. Yeah.
So this is not just about behavioural stuff in adulthood. These adverse childhood experiences that we're sort of not. It's not in the public. It is in the public domain, but it's certainly not in the public consciousness. Let's say, have real negative impacts on an adult's life as they grow up and become.
Hugely impactful. And I think I think what we all have to be aware of, and is whether we have children or not, to be honest, is the effect that society and the system, that think of things on a systems level. It's not just about that one individual. It's about how they are interacting with their community, how the role of friendships and the role of being, even silly things like just being a good neighbor, being aware of actually the impact that ACEs have on all of us, because the cost to society for children who have had those kind of really difficult early lived experiences are, like you were saying, it's a huge impact on our health system. It's a massive impact on a lot of the time on our justice system, because a lot of the time young people who have experienced those adverse childhood experiences can go on. I mean, I don't like to talk about things too deterministically because they can change, but often they will be drawn into drugs and alcohol. Drugs and alcohol can often be connected to crime, feeding that habit. I mean, the fact is that things like smoking or alcohol use or other forms of drug use are forms of coping. It's a coping strategy, isn't it? We're using substances like that to cope with a lived experience of feeling inadequate or unloved or dealing with difficult emotions that we've internalized over a long period of time that are going to bubble out in other ways. So that impact on some of the early research, when you look into preventative research, is that the more that you work at this age, that young age, is that it is actually saving society, not just money, but, on a lot of different levels. That impact later on is huge. And we had a conversation before, didn't we, about you working with adults. And I said, I was always drawn to working with children and teenagers because I felt hopeful, I suppose, that I still think in those formative stages, you can see change quicker. Whereas I might have a misheld belief that I think adults, we have things that are there that we've buried over, and we've got complexes and ways of coping that we've developed over a long period of time that we do to protect ourselves. I think that's harder to unpick by the time we're adults.
I definitely agree. I think by the time that you've got an ingrained pattern of behaviour, it can certainly be challenging. It's I can attest to the fact that it's not impossible. But I think what this there's a couple of things for me. This whole research area around adverse childhood experiences highlights how important it is that we need to start thinking about the impact of our behaviour as adults on children, both as caregivers and as a society. And I would personally like to see ACE's profile raised. And I know, and we might be able to talk a little bit later on about ways that we can all contribute to kind of being there for the children in our society.
Yeah.
The reason why I thought it would be useful for my listeners to hear about adverse childhood experiences is because often I'll hear in the therapy room, yeah, that happened when I was a child, but things were different back then, and it was acceptable to hit our children. It was acceptable, parents were stressed back then, and just because the research is only of the last 2 decades, it doesn't mean that the research was not valid before that time.
Or you couldn't still feel ashamed for being bashed in public or for feeling. Yeah, I hear that a lot.
Exactly.
I do hear this a lot. It's a bit like nails on a chalkboard to me, to be honest. I hear that a lot from people saying, "Oh, but it was the time. Parents didn't know how to parent that well. They're just doing," and I do believe that a lot of time parents are just doing the best that they can, or they're just doing the best that they know how to do with the tools that they have. But it doesn't change the fact that the impact that their behaviours, can have on their kids, regardless of what time we were living in. Yeah,
exactly. And what I hope from the conversation that we're having is that people can understand that, because oftentimes the behaviours that we have and the way that we are in relationships with other people, and maybe some of the coping mechanisms that we've adopted, can bring about their own sources of shame, which is a source of punishment for ourselves, and we won't speak out about them.
Yeah, and this is something that I talk about all the time in schools about, which is an uncomfortable conversation, because a lot of the time schools, like we said at the beginning, they depend on behaviourist approaches to controlling what happens in a school system. But what I feel like we know about developmental trauma is that children who have experienced relational developmental trauma are far more likely to feel shamed by a behaviourist approach because they don't disconnect themselves from what they've done. So a behavioural way of approaching when you try and work with somebody is that, you probably remember you going when you were back in school, I'm sure everybody can, is times when a teacher has put their name on a board, or they've given them a detention, or they've shouted at them in class. And for a neurotypical child, the impact of that is supposed to be guilt. So a young person is supposed to feel guilt, and the guilt is the corrective action. So the guilt is what changes them to modify their behavior, so then that doesn't happen again. But for children who've experienced developmental trauma, the punishment or the negativity that's given to them from that practitioner, they equate to themselves. So what they're hearing is, I'm not good enough. I'm a disgrace. I am, unworthy. I'm unlovable. I'm stupid. Those things that a behavioral system is designed to enforce that guilt response is actually having a far, far more damaging impact. It's shaming, and there's no place for shame-based approaches when we're talking about, attachment and, looking at emotion coaching and how we go about working in a different way. It doesn't mean to say that you just accept all the behavior that is, given to you. I understand that, teachers and parents have to feel like they are in control, but there are ways of doing that without having to be punitive or shaming about it. Yeah.
So it sounds like a teacher saying, sort of shouting at a child in a classroom that's not had adverse childhood experiences would internalize that as, I did something bad, and it would trigger a social response.
I'm bad. Yeah, and I'm bad. Yeah.
But somebody that's had developmental trauma would internalize it as, I'm bad, and there's something wrong with me, which is very different. And I suppose that just sort of hammers down the shame, hammers down the trauma, because that would be experienced as a sort of reaffirming traumatic event.
It's an interesting thing, isn't it, when you hear... I always think it's an interesting thing when you hear parents often say this to me about their kids that shout. The kids are shouting, kids are aggressive. And then you sometimes observe what that dynamic is like, and you hear parents or teachers shouting at children. And I think, well, even if you take it back to basics and you look at social modeling theory of how children might learn, depending on what they're observed, we have to model what we want to see in young people. If you shout at a young person, you're giving them permission, I think, to shout back at you. You're equating like with like. I think I sometimes hear in research, or you go to conferences. I heard one recently where they said when they go high, you go low. So you're having to sort of reverse that. So if somebody shouts at you and you shout back at them, you heighten that situation. But if you respond in a way that, I can see that you're upset, I understand that you're angry, when I would be angry too, that's really difficult. Where you're beginning to, you tune in, you recognize, you empathize, has a totally different effect. But I think we fall too comfortably into behaviorist, shaming, shouty ways of enforcing what we would perceive as being positive behavioral change. It's a strange notion, isn't it? Why, when you think about it logically, why you would think that would work?
One of my favourite expressions is, without awareness there isn't choice. And I suppose if, as a parent, you witness shouting as a tool to manage your family from your caregivers, then I suppose it's that behavioural modelling again, isn't it? It's like, well, my mum and dad shouted at me, or my caregivers shouted at me, so that's how you parent. And so the trauma gets passed down through the generations.
Traumatized systems, aren't you? Traumatized systems that just proliferate that. Yeah.
Sure. Yeah. I think one of the saddest things I saw recently was a parent, or looked to be a parent, screaming at their child to get in the car, and it frightened me. But the child seemed completely not bothered by it. And my sense of that was that the child was sort of disassociating in that moment to because it couldn't cope with the level of stress. It had just sort of taken himself somewhere else in his mind to protect himself from what was actually happening, because it was an act of violence. And I suppose that's not that we don't necessarily think of it that way, because everyone sort of says, well, kids are, it's stressful to be a parent and all that kind of stuff. And I do get that. I'm not a parent myself, so I hold my hands up and say, yeah, it's a really tough job. But perhaps what we're highlighting in this is no, it's not just acceptable to scream at your kids, because it can be perceived as a trauma, especially if the protective factors aren't there, if they don't have a safe space where they can go and regulate themselves and bring themselves back down to sort of the level. You're
creating ruptures, aren't you? Just in that even in that little moment, you're creating a rupture between that relationship where you're bawling at a young person to get into a car. You're unconsciously probably creating ruptures you're not even aware of, which is that, theory, I suppose, that early theory around attachment, and where that's coming from is that we're creating ruptures all the time by treating young people in that way. Now, granted, I get that all parents, even with the best intentions, sometimes will lose their rag with their kids. They might shout at them, but it's when that is a continuous, pervasive experience, and it's there all the time as part of who they are, that then we it's a bit like the good, the bad, and the ugly, isn't it? The good is where we've got that reparation. The bad is where it might have happened and nothing happened, but the ugly is where you're stuck in that really uncomfortable place, and there's no opportunity to repair or to get out of it. Repair is key, I think.
So talking about repair work, I'm really big on empowering people with the tools that they need to understand why they've got to where they've got to, who they are, and what's influenced that. So is there a way that people can understand their own adverse childhood experiences? Is there a tool? Is there a measure that they can do to go in and kind of see if they're affected by these ACEs?
So there is an ACEs. There's an ACEs there is an ACEs questionnaire. If you Google it, you'll be able to find one. But I often think that you probably don't need to be using a tool to assess whether you've had ACEs, because if you have, you probably will know. But you might not have, or you might not be at the stage where you're aware of it, or that you've convinced yourself for long enough that actually it wasn't a problem. So, for instance, young people that might have been smacked a lot when they were kids. They often hold on to those experiences as that I was a naughty child, or mum or dad were doing that because they were just disciplining me. But those memories of, being smacked in a public place have stuck with you for years, and you remember it. I think it's the remembering as well. If that's something that you've held on to for that long, long period, that's become part of who you are. That is developmental trauma. It's part of how your relationship with people will have been shaped in some regard on those kind of experiences. I think it's useful to tap into thinking about what are the things that we know keep us safe. So when do we feel at our best, and when do we know that those things are not happening, and maybe thinking back of in our experience of where things have happened where we didn't feel safe, or we have felt scared, or that did happen all the time, and mum and dad were arguing an awful lot, or one of the parents left when they were very young and they didn't have, lots of, like I said, I think most people have probably had at some point or another, an adverse childhood experience. I think you're doing pretty well if you've managed to get through childhood completely unscathed. But I think the key thing is that the more that we know about ACEs, the more you're able to help deal with your own, but you're also able to help stop them from proliferating on generationally, like we were talking about. And there's ways, obviously, we can talk about how we might go about like promoting repair, but in terms of being aware of it, I'm interested. What do you think? Do you think we're inherently aware of what our own ACEs are, or do you think sometimes we don't know? Children don't know, I don't think. I think because they accept things for how they are often. But as adults, I wonder if we shift.
I think we survive, and when we know that something bad has happened to us, I witness it all the time where people will create a narrative that minimizes that, because to minimize it makes it less of a threat. So, for example, there might be somebody who's witnessed lots of arguing at home, but they would say, oh, well, it wasn't that bad. I just used to go and sit in my room and watch TV. So I actually got time to watch TV, which I wouldn't have if my parents weren't arguing. So there's sort of like a positive reframing, which at the time as a child was probably very helpful.
It's useful. Yeah.
As a sort of survival strategy. But as an adult, it's sort of that there's been a lack of acknowledgement about what that really meant. And sometimes the mind hides things from us for a reason, because as we said, we're first and foremost here to survive. So I think...
Well, and we know even more so from that now, don't we? That there's new kind of research which has come out recently, which I think is really interesting, which is that when we're in extremely stressed states or we're subject to extremely traumatic events like, domestic abuse or violence taking place, our brain actually floods our body with vasosuppressants, and I think it's called diorphin, but it's a type of it's a suppressant that actually affects our memory systems, so that we actually sort of disconnect that from our sort of conscious state. And I think it's because it's to help us continue to function so we don't shut down. So you might have found that sometimes people talk about when they've been bereaved, they didn't cry. They didn't cry at a funeral, they didn't cry when it happened. And then that happens maybe, 3-4 months later, all of a sudden something changes or the floodgates open. I think it's what you were saying, it's our way of keeping ourselves safe. It's that survival instinct all the time, isn't it? Disconnect away from that shock state or that shock experience, so you don't fall apart.
I definitely agree with that, and I think what whilst on a conscious level we might be suppressing something, or on a subconscious level we might be pushing something away, it inevitably comes out in our behaviours. So, for example, you might find that you're hypervigilant. You might find that you're one of these people that's just constantly can't sit still, and even when the doors are locked and the lights are down and there's chilled out music playing at home, for some reason you feel fidgety, or the slightest noise gets you sort of activated. And I know that there's some theories around that in terms of what's happening in the nervous system in that moment, because as a child, if your nervous system has been activated all the time and you've not been familiar with a calm state and regulation. So I think
you've been reading a book recently, haven't you, on polyvagal theory?
Yes.
Yeah, and about our vagus nerve, that 10th cranial nerve, which is connected to our heart, our digestive system, our lungs. When we're in that excited state, you can feel it yourself, can't you? When you're losing you're losing your cool. But I also think it's a bit more. It can be even more than just on that physiological level of feeling hyperstimulated. It can be about why we might continuously sabotage the relationships that we have with people that we could potentially have meaningful relationships with, because we're constantly protecting ourselves from getting hurt or being in a position where we make ourselves vulnerable, because that puts you back into that ugly place again, doesn't it, of where you felt powerless. It's about power, I think, sometimes with young people, is that they often are in a powerless kind of place to be able to control what's going on around them. So they do whatever they can to cope.
And the sad thing is, if you've survived adverse childhood experiences into adulthood, the chances are that you will gravitate towards a relationship that replicates the one that you had as a child, because it's familiar and you know how to stay safe in it. Whereas to step outside of that and do something, you're sort of stuck in a bit of a trap, because your mind and body is saying, do everything to keep yourself safe. So i.e. don't do something that's unfamiliar because that's risky. I know this relationship is either unkind, abusive or dysfunctional, but actually, do you know what? You know how to manage this because you've managed it before. And that might not be happening on a conscious level, but the amount of times I sit with people and they're like, I just keep ending up with this type of person that's really unkind to me, and it's just a cycle and I just feel like it's inevitable. But at the same time, the thought of being with somebody who treats me well, I don't know how I'd handle that, and that feels
that's like that cliche of like having being attracted to a bad boy.
Yeah.
Where does that come from?
Yeah.
That needs
I think we know now.
Yeah, well, you just said it yourself. Yeah.
So there's some really interesting things there, and I think could we talk a little bit more about attachment theory? Because I know we've covered the ACEs now, and I think I'd like to come back to that just before we finish, about what can we do as adults to sort of help children with reducing adverse childhood experiences. And I think awareness is certainly a big factor in that, but there might be some more practical things that we could do. But moving it into the impact that these things can have on us as adults. You mentioned attachment theory. I gave a book recommendation the other day, a book called Attached, which kind of breaks down attachment theory into a very sort of layman's terms. But you tell us, what is attachment theory and what are the main attachment styles?
So attachment theory was a term that was John Bowlby was one of the earliest researchers in that field. It's quite an aged theory, but it is still incredibly relevant, I think, today. I think we've developed it with our understanding of neuroscience. But basically, attachment is, in simple terms, the synchronous bond that is created between a caregiver and their offspring or their young person that they're looking after. And in order for when somebody is what we call securely attached, they tend to be able to feel emotionally regulated, they feel safe, they feel calm, they're able to go out and explore into the world and have meaningful relationships with peers that in time might develop into relationships or sexual relationships, long-term relationships. And our early attachment relationship is fundamentally our blueprint for what comes later. That's the theory. When children are insecurely attached, we see three main types. So we look at ambivalent attachment, we look at avoidant attachment, and we look at disorganized. Disorganized attachment is typically the rarest form of insecure attachment, and it's the one I suppose that has coined some of the most sort of research in the literature. So if you look at like the work of Michael Rutter, Professor Michael Rutter, he's done decades of research on deprivation. So you look at the original sort of Romanian orphanage studies where children have been left to cry themselves to sleep at night, or where they haven't been changed. Nobody has come to soothe them. They haven't been held. And they're almost in that kind of frozen state. That's the area. But what we see most of the time is, I would say, probably either avoidant or ambivalent. So an avoidant attachment style in a young person would look like that they are often happy to get involved with focusing on a task, so something that they might be asked to do, but they are avoidant of the relationship with an adult, so that they don't want to connect with that person because, for example, if we're talking about that they might have internalized through their internal working models, that term that we use, that adults are not to be trusted, that they are inconsistent, that they are people who are going to hurt them. Why would you want to have a relationship with why would you put yourself in that risky place where somebody is going to do that to you? So we call that an avoidant attachment style. The other style that we have is something called ambivalent. So an ambivalent attachment style is where the young person tends to be overly clingy or overly attached sometimes to either a caregiver or a partner. And that would be that they want that attention all the time, and they'll do anything possible to draw that attention in. So when I see kids in school, sometimes it might be a kid that does not want to do what their teacher is telling them to do. They do not want to do the work. They're not interested in the task unless it has a real hook, something that's really interesting to them. But generally, they don't want to get involved in work, but they love adult-orientated attention, because any attention, regardless of what it is, to them might be perceived as being good. So if you think about this is the interesting dichotomy, I suppose, that we have in school is which children in a classroom of 30 get the most attention from the teacher?
Yeah, it'll be the ones that want the attention from the teacher because they'll they'll do what they need to do to get the attention.
Yeah, so the kid that's sitting doing their work, being really well regulated, scribbling away, not asking lots of questions, not bothering their peers, is the one that the teacher will often pay the least attention to. The child that is acting up, that's throwing things, that's, you know, that is acting out all the time is the one that adult will focus on the most. So it doesn't matter whether the attention that young person is getting is positive or negative, they're getting attention. So that ambivalent attachment style is where kids are drawn to wanting adult involvement all the time. And that can be sometimes because they haven't had it, or that it's a bit like, you know, when they get a little drop of it, a little taste of it, it's like, oh, this is great, but then it's taken away all the time. So it's not consistent. And there's a lot of research, which I'm sure you're probably more aware of how those early attachment patterns then are transferred into adulthood. So we sometimes see, you know, adults who are really difficult to reach, that you sometimes make impassioned pleas to, or you try and tap into their feelings, but they're somebody that keeps you at arm's length all the time, or won't allow you to, no matter how hard you try, to develop a close relationship with.
It's really common to see somebody who's got this very, and I don't like the word, but it's the most known word, like needy, sort of very clingy attachment style, because that's how they got their attention as a child, was to cling, was to sort of constantly cry out for attention. It's often the case that those people will be attracted to somebody that has the opposite attachment style, so they might be very avoidant. So you can often see this sort of like the language might be
confused, doesn't it?
Yeah, the language might be, you know, it was great in the first few months, and we just were just like, it was like fireworks were going off, we were talking about kids and marriage, and then further down the line, you know, now he's saying that he wants space, or she wants space from me. And it's like hot cold, because actually what's true for both styles is that both styles want connection, both styles want intimacy, but both are fearful. One's fearful of losing it, and one's fearful of kind of being hurt and consumed by it. So you end up with this sort of this dance that happens, and it can be sustained, and that cycle for the people in it can become addictive.
I like that word, a dance. It is a bit like a dance, isn't it? It's like it's a sustained, continuous cycle of until you punctuate that cycle with something. People, that's why I was saying before about the relationships that people get themselves in or sabotage those relationships, is because they're perpetuating that attachment relationship that they probably on some level are not aware of.
Sure. And that's when it comes to the healing part, and I suppose this is a nice sort of summary really, because understanding what happened to us in our early relationships and what happened to us as children can give us the awareness of how we've come to relate to the world around us and to the people within that world and to the close relationships that we have. And once we've got that awareness, then we can set about healing from that past trauma. And that's the big part in, you know, we've done an extensive piece, I think, about understanding what is developmental trauma. And I suppose the rest of the series of podcasts and the work that we're doing at the moment as therapists and everything else, you work with children, and I can totally understand why. But I think there is hope out there.
Challenging in and of itself.
Yeah, of course it is. And I think, you know, it is important to try and get it at the source and make adjustments there. But there is so much that we can do as adults. The big message that I want to get out there is there's nothing to be ashamed of about your history, because even if your parents mistreated you or your caregivers weren't there for you and you've experienced developmental trauma, that's not your fault. And once you can start looking at it through the lens of compassion and empowerment, then you can go, oh, this is what happened to me, and now I can set about healing that so that I don't keep finding myself in difficult relationships, and I can actually have a more fulfilling life.
Compassion, because it's about, we often talk about compassion to other people, but this is really about compassion towards yourself, isn't it? About being kind to yourself and actually thinking, I often say that to young people that I'm doing therapeutic work with. I'll say, you do know this is not your fault. It's not your fault. And I often will say, I need you to hear this. You might not believe it, but I need you to hear this. This isn't your fault. You know, you are, you know, regardless of what you feel like you've done, regardless of what your behaviors have been, I am a strong believer that we are products of, our environment. We're products of which is a like a lottery, isn't it? It's a job. We don't know what we're going to be born into and what environment we are going to have to face. And even within the best will in the world and the you think you might have, everything stacked in your favor, things can still go awry, and that's okay. It's okay to not be okay. It's just that's the first step, really, isn't it? About therapeutics or about healing and about repair is just, I think therapeutics for me are always about a readiness to change. And I think the first step of readiness is actually just saying to yourself, it's okay that I'm not feeling all right, or it's okay that it's not okay that obviously awful things have happened to me, but it's okay that I'm coping with it in the best way that I can. And I'm open to talking about it. I think that is the first step, isn't it? It's just admitting that maybe you want to feel differently.
Definitely. I think healing work is hard enough, but when you compound it with shame, it makes it very difficult.
It does.
So that feels like a nice sort of place to sort of start summarizing. So there's going to be people listening thinking, oh my goodness, what can we do for children? How can we help minimize these adverse childhood experiences now I've got all this awareness? Where would you direct them? What would you sort of say that people can do if they have a sense of wanting to do something practical and meaningful, or just to educate themselves?
So there's Public Health England, for example, and Public Health Wales. If you type in adverse childhood experiences into Google, there's some great video links on there about. There was one I watched recently. It was from Public Health Wales, which was about a young person talking about his experience of living with ACEs and what he felt like his later life had kind of become, but how he was able to change that trajectory by being aware of those experiences that he had. I think that it's really worth looking into some early reading if you've got children, or even if you've got, if your kids are teenagers, or you've got nieces or nephews or just friends of friends that have got kids. It's always worth looking into, books around attachment. Margot Sunderland's stuff is lovely. There's a great book by Sue Gerhardt, which is called Why Love Matters, how affection shapes a baby's brain. You could read things around about, this is a great book, this is one I love. It's Working with Relational and Developmental Trauma in Children and Adolescents, great for practitioners, but also great for anybody that works with children that you think might have encountered adversity. I think it's about just being more mindful about actually just what developmental trauma is and how it is separate from post-traumatic stress, that we don't think of trauma in those terms all the time, that actually our lived experience can be tricky, at any point in our lives. And what are the things that we can do to help protect ourselves? So as adults, I think that we get very good at learning to pick up on things that make us feel better. So it might be a case of, a lot of adults, like a glass of wine, but it might be that they take themselves to a yoga class, they take themselves out for a walk, you take the dog out, you have a nice meal with somebody you care about, you listen to a piece of music. These are all things which help soothe us. And the things that help soothe you will also help soothe children a lot of the time. So, helping them be in a quiet space, helping to sort of help regulate and keep them soothed and calm. I actually think when, you were saying about polyvagal theory and that whole thing around keeping calm, that is fundamentally what it is. We know the more that children feel soothed, the better their outcomes are. Something that simple. If you feel soothed, you feel safe. And if you feel safe, you're more likely to be able to listen, to be able to learn, to be able to focus on learning. All those things come simply from feeling safe and feeling in this kind of calm, relaxed place. So the more that we can do to promote that for young people and ourselves is the better.
And you talked earlier about protective factors, and I think, you said that, we might have young people in our lives, and I suppose that's where the role of schools and our roles as aunts, uncles, grandparents, family members, we can all have we might not be able to directly impact what's happening for that child at home, but actually if when they're with us or around us or in our presence, we are modeling behaviors of calm, modeling behaviors of regulation.
And staying free of judgment as well, because, Brené Brown says in her she talks around empathy, and she said, part of working with people part of working with young people so often is staying free of judgment, which is difficult, she says, because we enjoy it so much. But is that being in that place where you say, that's really difficult, or that's really hard, or I can imagine, you think of the young people sometimes, even silly things like they build a Lego tower that another kid comes and trashes, and they've spent a long time building that Lego tower. And instead of saying things like, we use that at least all the time, well, at least you can build another one. That doesn't make you feel better. I think empathy is so powerful. It works with adults, but it's certainly applicable to working with young people. The more that we are aware of how to be empathetic, the better we are equipped to being able to understand, because to be empathetic, means staying free of judgment, but it also means connecting with something that might be uncomfortable for you, that you're basically saying, I get it. I get that you are feeling disappointed. I understand that you must be feeling angry. I get that you're sad, and that's okay. And, you're not trying to fix it. I often say, adults and teachers want to fix things all the time for their children and for kids. And I said, sometimes you don't want to be fixed. You just want to be heard. And maybe that's a nice point to kind of, as part of our summary, is, sometimes kids just need to be heard, but not fixed, because that's a much larger issue, and rarely does that an empathic response ever, is it ever going to be something that you respond to them is going to make them feel better. What makes them feel better is connection. And it's about valuing our relationships and never underplaying actually how important relationships are. We know why, kids don't do well. We know why they drop out of school. We know why, they struggle. But what we so rarely talk about is the value of relationships and human connection. So I think the more that we can do that, the better you will be at preventing some of those ugly things that we talked about.
That was a perfect summary, and I suppose I'll just add to it that I've got hope that people like you are in the world working with our young people.
And you.
I'm kind of picking up the aftermath, if you like, and there is hope there as well. But it's really good that that this is out there, and I think over the next few years it's just going to get more and more attention, I hope. I think so. Because it makes sense and it's got such a big impact. So thank you for sharing all that you've shared. It's clear that you're very passionate.
We talked for over an hour. It's like, where's that gone?
Yeah, I do. And I feel like we've opened up loads, so there's probably going to be all sorts of questions coming through after that. So maybe in the future you'd be kind and maybe a few months down the line hop back on and answer some of those questions, because I think we've opened a lot and done some of it justice, but of course it's a massive topic, so we could probably talk all afternoon. But thank you very much, and I will post the links that we talked about to some of the information that you've shared and some of the books that you've recommended in the podcast bio. Okay,
cool.
Take care.
Thank you.
I hope you enjoyed that podcast. It's clear that Craig is really passionate about what he does and is very knowledgeable too, so I hope that there are some takeaways for you in there. For me, there was a message of hope that there are people like Craig in the world working with our young people, but also that you can heal too. I guess our minds tell us stories, but the truth about who we are and what we've been through comes out in our relationships and our behaviours. We're going to be listening to different people over the next few weeks from different walks of life. I've got some personal stories coming up in the podcast series. I've also got different therapists coming on to talk about their modes of therapy. So share, like, comment, let your friends know about this, let your family know. I think there's some really interesting people that need to be heard and deserve to be heard. So like, comment, share. And if you've got any questions or you'd like to feature on the podcast, then reach out to me too. Much love as always. Speak to you soon.